Sports report. Carlos Correa issue could creep up toward end of Mets deal, medical expert. Correa underwent arthroscopic surgery in 2014 to repair a fractured fibula and minor ligament damage, suffered while sliding into a base in the minor leagues, and had a metal plate inserted to help stabilize his right leg. The fact that this happened 8 years ago, and he hasn't had any real issues with it since usually means that it's actually holding up pretty well, Dr. Brandon Erickson, an orthopedic surgeon at the Rothman Orthopaedic Institute who has not examined Correa, said Wednesday in a phone interview. Now, the Mets and Correas camp are trying to work through the issue, with one possibility being the addition of contract language to protect the club should Correa's old ankle injury sideline him for an extended stretch. It's something that wouldn't necessarily have any impact on him for the next 3 to 5 years, but if you're going for a 10 to 15-year contract, for him, a 12-13-year contract, you can worry just a little bit that down the road, could that creep up and be something that could potentially bother him towards the back end of the contract? Erickson said. Correa's agent, Scott Boras, insisted last week that the star shortstop had no current issue, but that all the conjecture and evaluation of him has been about physicians using their crystal ball for years to come. Erickson, who previously worked as an assistant team physician for the Mets during his fellowship and now serves as an assistant team physician for the Phillies, said doctors performing physicals are in a difficult position trying to predict how a player's health will hold up long term. Whenever you sign somebody to an over 10-year contract, there's always an inherent level of risk with anything that's popped up in the past, Erickson said. Honestly, we can give our best guess, but it is just that, it's just a guess. Sports report.